Hi everyone, my name is Dr. Michael Wald, otherwise known as the Blood Detective, and thank you so much for joining me today for, I think, a fun conversation and also a very practical one from a health point of view that I've entitled Mushroom Coffee versus Regular Coffee. I'm a doctor of chiropractic with a board certification in nutrition. I'm a dietitian and sports nutritionist. I provide acupuncture and I'm a life coach. I also graduated medical school, earned my MD diploma, but I did not seek an active medical license. So, mushrooms. I've always loved mushrooms, and I certainly have always loved coffee. So when I first heard the idea of mushroom coffee, a blend of mushrooms and regular coffee, I was very, very interested in this. And I'll tell you why as we move along. So the information I'll be discussing with you right now is not meant as a substitute for sound medical or health advice. It's meant for educational purposes only. So what are some key ingredients differences between mushroom coffee and regular coffee? So with mushroom coffee, we know it's made of a blend of ground coffee and powdered medicinal mushrooms. This is the mushroom and the coffee. Some of those mushrooms might be lion's mane, chaga, cordyceps, and reishi mushrooms. And in regular coffee, we're dealing with purely roasted coffee beans. Love the smell of those coffee beans. And in terms of the caffeine content, the amount of caffeine in mushroom coffee, that is mushrooms along with coffee, is usually about 50% because you're using about half of the amount of coffee, depending on the ratios of the mixtures in various companies that produce mushroom and coffee combinations. So the mushroom coffee by itself typically has less caffeine, about half or less, which may reduce the jitters, anxiety, insomnia, nervousness, all of the sort of side effects of too much caffeine. And regular coffee compared to mushroom coffee obviously has higher caffeine content, and that could lead to more energy, increased athletic potential, and also but crashes as well, and insomnia, just to name a few of the side effects. So in terms of health claims of mushroom coffee, they're promoted for a variety of potential health benefits, including focus, which is attributed to lion's mane mostly, immune support from the mushroom chaga, stress reduction reishi, and better stamina, which is attributed to cordyceps. But these mushrooms are very similar in effects as well. And I'm very interested in telling you more about the anti-cancer effects of mushrooms in just a few minutes. So research is ongoing with mushrooms quite a lot, and most of the research that I've read over the last 30 or so years have been out of Japan. Regular coffee is also linked to various health benefits like alertness and energy, mood improvements, and increased metabolic rate, and it's rich in antioxidants. Of course, so are the mushrooms. So 10 ways that mushrooms are anti-cancer. I just had to put it in here because, when I first took a taste of the mushroom coffee combination, I honestly didn't like it because it's not just regular coffee, and I love the taste of regular coffee so much. But as I forced myself to drink the mushroom coffee in the morning every day, it took me about 2 months to get to the point where I found it difficult to tell the difference even between regular coffee and the mushroom coffee combination. My taste buds have accommodated obviously to that. But again, when I've been practicing holistic medicine for many years, and I've been aware of the tremendous amount of scientific evidence that supports anti-cancer effects and mushrooms. So what I'm trying to say here is, as much as you love your regular tasting coffee like I did, the knowledge of these anti-cancer effects and other health benefits, along with the fact that it is something, the mushrooms, that one can get used to, made me very excited to try this and to switch over. So I'm not going to mention any specific brand of coffee mushroom combination. So we know that mushrooms have a variety of anti-cancer effects, and here's some of them. It stimulates mushrooms in the various types. I'm not going to be specific to which type of mushroom. You always want to use a combination though. It stimulates immune cells, T cells, natural killer cells, and macrophages. And then mushrooms enhance natural killer cell activity to the point where even if someone has low number of natural killer cells, they will work more effectively. And it also, mushrooms, inhibits tumor cell growth and proliferation. So tumors like to grow, obviously that's why they're tumors, from abnormal cells, and that abnormal cell growth is called proliferation, so mushrooms help suppress that proliferation. And also mushrooms can trigger apoptosis. Apoptosis is just a fancy term for programmed cell death. That's the way in which you want cancer cells to die. And then there's other ways that they die that are more toxic and stressful upon the body. But mushrooms promote the apoptosis. And then it also stimulates angiogenesis in terms of reduction of angiogenesis. So angiogenesis is the growth of and opening up of new blood vessels, and that could feed a cancer. So you want to inhibit that. So mushrooms are inhibitors of angiogenesis, of blood vessel growth. They also modify favorably inflammation. They balance gut microbiota, the beneficial gut in the intestinal tract. They act as very potent antioxidants. There are detoxification effects of mushrooms. And also, when you give mushrooms to people on radiation and or chemotherapy, they simply do better. So that's what we call a super synergistic effect: chemotherapy and or radiation and mushrooms. And here's 10 ways, to be fair, that caffeine can also protect against cancer. So caffeine stimulates apoptosis, the programmed cell death, and caffeine inhibits DNA damage, which is the necessary step which causes abnormalities of cells, and then the cells replicate, and that, of course, is a problem. Caffeine has antioxidant activity. It reduces systemic inflammation. It helps repair DNA. Caffeine and other constituents of coffee inhibit tumor-promoting enzymes. We don't want to promote tumor-supporting enzymes, so it's great that caffeine can reduce this. We know that caffeine disrupts cancer cell signaling, so if one cell tells another cell signaling to that cell become cancerous or proliferate abnormally, that signal is reduced. Also, caffeine can improve the effectiveness of chemotherapy and radiation, including reducing the side effects of chemotherapy, because caffeine helps to detoxify these highly toxic chemotherapeutic agents. And reduces the risk, caffeine, of liver, colorectal, and endometrial cancers, and it also improves metabolic detoxification. And I'll throw another one in there. Caffeine also not only improves mood, but as a liver detoxifier, that helps to guarantee that the body has a lower level of inflammation. So in terms of some other comparisons between caffeine and mushrooms, a mushroom coffee's taste is more of an herbal taste, an earthy taste, as some people like to describe it. And some people find the mushrooms milder or more pleasant than coffee. Coffee tends to have a much stronger flavor, bolder flavor than most mushroom drinkers are used to, and vice versa. And with mushroom coffee, it may be easier on the stomach because the lower caffeines help reduce potential issues like anxiety and digestive discomfort, which can result from cramping of the caffeine signals to the nerves in the intestinal tract. And then sometimes coffee can upset the stomach and or cause jitteriness and digestive upset, even gastrointestinal reflux. That is not something that characteristically happens with mushrooms. And the mushroom coffee is basically a lot easier on the stomach and the system overall. So, a few final notes here. 5 additional benefits of coffee. It enhances mental alertness. It's rich in antioxidants. It reduces the risk of degenerative diseases of the nervous system. Can improve physical performance. It certainly, caffeine improves my running. Lowers the risk of certain diseases like dementia we just mentioned. And as far as 5 adverse effects of caffeine, bad things, it can cause insomnia, that is, and disrupted sleep. Caffeine may produce jitteriness and anxiety, digestive cramping, loose stool, increased blood pressure, usually in the short term. That once you're on coffee for a while, that's not usually something that happens, but it can. And there's a dependent and withdrawal aspect of removing oneself from caffeine. In terms of 10 health benefits of mushroom coffee enhances mental alertness and focus as well. It reduces inflammation, it supports the immune system, is a potent antioxidant, has anti-cancer effects, it lowers stress and anxiety, improves gut health, enhances energy levels, improves liver function, including detoxification, and even heart health. Those are all potential benefits of mushrooms. So you're seeing here that both mushrooms and caffeine have lots of beneficial potential benefits for human beings. And there's also some negative things. So it's important for you to speak with your healthcare provider, given your whole context of your health situation, including medications, your diet, your exercise, sleep, stress. All these things come into play to choose whether or not you should have coffee, you should have mushrooms, or a combination of each. So last slide here in terms of 5 potential adverse effects, bad effects of mushrooms. Number 1, the taste may be unpleasant for some. There is a good amount of scientific evidence for mushrooms in a variety of diseases, but I had to put here limited scientific evidence for some claims because that is true. But most of the claims are pretty well rooted in science, like the anti-cancer claims of mushrooms. Possible allergic reactions due to fungus. So mushrooms are fungi themselves, and they grow other fungus on them. So a person who has a peanut allergy, for example, which is usually a reaction not to the peanuts but to the fungus, should avoid mushrooms altogether. So obviously speak with your healthcare provider whether or not mushrooms and/or caffeine and coffee are appropriate for you. There's potential digestive upset issues in persons sensitive to mushrooms, and the mushrooms may interact with certain medications and conditions. Because mushrooms can improve detoxification, they might actually move medications through your system faster than you want them to be moved through your system. So in the context of deciding whether or not someone should have, whether it's a mushroom and coffee combinations, or alkaline water, or whatever the thing is, a detailed interview should be conducted with the individual. Oftentimes, very well-educated people make pretty bad decisions when they're choosing things for themselves. They don't know sometimes what are the important considerations when adding something as seemingly innocuous as mushrooms and coffee combinations. And ultimately, when I figure out what a person's needs are, which may include, saying, yes, coffee, mushrooms are fine, you always want to review someone's dietary intake and fluid intake for several days, making sure that their fundamental health needs are being met in terms of protein, carbs, and fats, and basic nutrients. If people are on the right nutritional supplements, that's great. Make sure that the doses are correct. And then I usually will meet a patient every few months and decide whether or not the prior recommendations make sense now, given their feedback and how far they've moved towards their health goals. So thank you so much for joining me for this, I hope, informative and practical conversation about mushroom coffee. I'm going to go grab another cup right now, and I'll see you at the next presentation.